How is gonorrhea transmitted? Gonorrhea is a sexually transmitted disease caused by infection with the Neisseria gonorrhea bacterium. It infects the mucous membranes of the reproductive tract, including the cervix, uterus, and fallopian tubes in women, and the urethra in women and men. It also infects the mucous membranes of the mouth, throat, eyes, and rectum. Gonorrhea is also commonly known as the clap. Gonorrhea is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. Ejaculation does not have to occur for transmission to happen, and it can also be spread perinatally from mother to baby during childbirth. Risk factors for gonorrhea. Sexually active people can get gonorrhea through vaginal, anal, or oral sex without a condom with a partner who is infected with gonorrhea. Risk factors include people that are younger than 25 years and older with risk factors such as new or multiple sex partners, or a sex partner who has had a sexually transmitted infection. Gonorrhea is also the second most common STI caused by bacteria, and around 1.4 million new gonorrhea infection cases occur in the United States every year. Many men and most women with gonorrhea are asymptomatic. However, some signs and symptoms of urethral infection in men include pain or burning when urinating, white, yellow, or green urethral discharge, testicular or scrotal pain, and testicles may be swollen. Signs and symptoms of urinary tract uterus infection in women include pain or burning when urinating, increased vaginal discharge, vaginal bleeding between periods, and pain during intercourse.
Signs and symptoms of rectal infection in both men and women include discharge, anal itching, soreness, bleeding, and painful bowel movements. Signs and symptoms of a throat infection in both men and women includes a sore throat. Gonorrhea infection in babies may cause blindness, joint infection, and life-threatening blood infection. Nucleic acid amplification test and gonorrhea culture and sensitivity test are two tests used to test for gonorrhea. The NATT test finds the genetic material or DNA of gonorrhea germs. This test is done by obtaining a urine sample or swabbing the site of potential infection. The gonorrhea culture and sensitivity test may be done if one is not getting better after the treatment. It can find the bacteria that cause a gonorrhea infection and the right medicine to treat the infection. This test is done by obtaining samples of body fluid from the infected site. If a gonorrhea infection is suspected, abstain from sex until the test results have come back.
Treatment of gonorrhea. Gonorrhea can be cured. Antibiotics in forms of pills or injections are prescribed to treat the infection. Both injections and pills may be given to treat some strains of gonorrhea that are antibiotic resistant. Pills, 1-day regimen or 7-day regimen. The CDC recommends a single dose of 500 milligrams of ceftriaxone intramuscular. Alternative regimens are available when ceftriaxone cannot be used to treat urogenital or rectal gonorrhea. Do not have sex for 7 days after the start of treatment. How to prevent gonorrhea. The only way to prevent gonorrhea is not to have sex. However, for many people, a more realistic goal is to reduce the risk of contracting and spreading gonorrhea. To reduce your risk of gonorrhea, always use a condom or dental dam. Don't have sex with someone who has an active infection, limit sexual partners, and communicate openly about sexual activities, and get tested for gonorrhea and have your partners get tested too. Complications of gonorrhea. A test of cure is needed following treatment. It's a follow-up test to be sure the infection was treated successfully. Test is not needed for genital or rectal infections. Test is needed 7 to 14 days after treatment for pharyngeal gonorrhea, infection of the throat. Return to healthcare provider if symptoms continue for more than a few days after receiving treatment. If left untreated or not successfully treated, complications may occur as higher risk of HIV, pelvic inflammatory disease, infertility, ectopic pregnancy, disseminated gonococcal infection, and reoccurrence of infection. Nursing management of gonorrhea. Testing for gonorrhea requires a urine sample or a genital, rectal, or oral swab. It's important to use antibiotics and to finish the regimen and to not share with your partner. Educating the patient on signs and symptoms of gonorrhea, letting them know that all partners must be treated, to abstain from sex to avoid being infected, proper use of condom that can reduce the risk of transmission, and recommended yearly STD testing.
Hey girl, how was your weekend?
It was so crazy. I went to this party and I met this guy.
Oh, you met a guy? Did you guys do anything?
Yeah, to be honest, I met him just that night, but we already went back to his place and hooked up.
No way. How was it?
It was good, but sorry if this is too much information, but I'm peeing a lot and it hurts a lot down there and I'm bleeding, but I'm not on my period.
That doesn't sound very good. Did you guys use a condom?
No, we didn't use anything, but he seemed clean and he pulled out.
So you didn't use any protection at all? Aren't you worried about catching something? My cousin had the same symptom as you, and it turns out that she has the clap.
I'm kind of scared now.
Maybe you should go get it checked out. There's a clinic here in Stockton off of Hazelton Avenue.
Yeah, you're probably right. I'm gonna go get checked out.
Case study situation. Jane Doe is an 18-year-old female presenting in the ED with complaints of painful and increased frequency of urination, sharp pelvic pain, vaginal bleeding in between periods, and increased vaginal discharge. The patient states that they recently had unprotected sex with a partner they met for the first time at a party 2 weeks prior and stated that, "I didn't see any evidence of infection, so I thought it would be fine to skip the condom." The client appears anxious and states, "I'm really scared. I heard that gonorrhea isn't treatable and I'm worried about what my friends will think of me. What if they think I will pass it on to them?" ADPI assessment. Vital signs show a temperature of 38 degrees Celsius, heart rate of 88 beats per minute, respiratory rate of 18 breaths per minute, blood pressure 126/76, and pain 8 out of 10. Medical history is obtained, and the patient is otherwise healthy. Sexual history is obtained, and a pelvic examination is conducted. ADPI diagnoses. Acute pain related to infectious process secondary to gonorrhea, as evidenced by painful urination, pelvic pain, and vaginal bleeding in between periods. Hyperthermia related to inflammatory reactions secondary to gonorrhea, as evidenced by increased body temperature beyond the normal range. Impaired urinary elimination related to the inflammatory process secondary to gonorrhea, as evidenced by painful urination. Anxiety related to threat of self-concept, intrapersonal transmission, and contagion, fear of transmission of the disease to family or loved ones secondary to gonorrhea, as evidenced by increased tension, restlessness, and stated fear. Deficit knowledge related to lack of exposure, misinterpretation of information secondary to gonorrhea, as evidenced by statement of misconception and development of preventable complications.
ADPI plan. 1. Treat symptoms with PRN pain medication. 2. Treat condition with antibiotics. 500 milligrams intramuscular dose of ceftriaxone. 3. Provide education for misconceptions on disease, transmission, treatments, prevention, and support groups. ADPI interventions. Acute pain. We will perform a PQRST assessment of pain, administer analgesics as prescribed, encourage adequate sleep or rest. For hyperthermia, we will monitor vital signs, assess temperature every 2 hours, increase patient's fluid and nutritional intake, administer antipyretics as prescribed, impaired urinary elimination, monitor patient's voiding pattern, urine frequency, odor, consistency, volume, color, compare to patient's eyes and nose. ADBI interventions continued. Anxiety. Assess level of patient's anxiety, instruct patient to perform relaxation techniques, provide accurate and consistent information on the diagnosis, treatment, and prognosis of the disease, provide safe space for patient to openly discuss feelings about their condition, allow them to express fear, anger, and despair without confrontation, refer to psychiatric counseling as directed. Deficient knowledge. Review the progression of the condition and the outlook, review the transmission of the disease, review patient's medication schedule, interactions, and side effects. ADPI evaluation. Can the patient verbalize understanding of the disease, treatment, transmission, signs and symptoms, and prevention? Does the patient begin to have normal voiding habits? Does the patient take prescribed medication and understand the medication regimen/side effects? Does the patient have decreased symptoms of anxiety, stable vital signs, and statements such as, "I feel better now knowing I can treat this disease and will not transmit it to my friends or family"? Does this patient have an acceptable/decreased pain level?
Below are community resources in the San Joaquin Valley. San Joaquin County Public Health Services, Planned Parenthood.